Over 70,000 people lose their life to a drug overdose each year. Approximately 32% of the U.S. adult population has lost someone they know to a fatal drug overdose. Welcome to Normalize the Conversation. I'm your host, Francesca Reicheter, and today I'm joined by Patricia Roos, a former sociology professor at Rutgers University who lost her son, Alex, to a heroin overdose in 2015. It was then she shifted into activism, sharing her story in her book, Surviving Alex, A Mother's Story of Love, Loss, and Addiction. In this episode, I sit down with Pat as we dive into the root causes of substance use, the gaps in our behavioral healthcare system, and the critical need for harm reduction and insurance parity. Join us as we explore why open conversations are essential to shifting perspectives and sparking real change.
Pat, thank you so much for joining me today. I am very excited for our conversation, but before we begin, I just want to check in. How are you really?
Am I doing?
Yes.
I'm doing pretty well today. Yeah. I published my book in May, and it's getting lots of play, and I get to talk with wonderful people like you. It's great because I'm meeting a lot of different people, and so back when I was doing publishing within sociology, I really they didn't have podcasts, so we didn't have these kinds of conversations, and so I really enjoyed them.
Oh, that's amazing. Congratulations on your book. That is huge. Would you mind telling us a little bit more about your book?
My book is about my son, Alex, who died at 25 years old and of heroin overdose. And as you can imagine, that just threw our whole world into total disarray. But it was already in disarray when he was in active addiction. So he had about 3 years of active addiction, but it really started back when he was 12 and into 13 years old when he had anorexia. So that was kind of the first sign that something horrid had come into our good family, as I call us in the book. And Alex had tremendous anxiety and depression, but we didn't see any of it until he was around 12 years old. And then, how every family has scrapbooks, where they keep all those pictures. Nowadays, it's digital pictures, but back then we have scrapbooks and scrapbooks full of lots of pictures, actual pictures that you actually see as opposed to digital ones. And when in writing this book, I went back and I looked at those pictures, and it happened so fast because right around when he was 12, sixth grade, actually it was the beginning of seventh grade, and he just stopped smiling. I mean, just within a space of a month, he was laughing. I mean, he was such a joyous, smiling, wicked sense of humor. He was just, like the kind of kid that everybody wants to have. And then he just stopped smiling. And that was really the precursor to substance use issues. And I remember a friend telling me at the time when Alex was going through the anorexia that she had read about a link between anorexia and drugs. And so from that moment, from that just exact moment, I thought, oh my God, this is not over. And even though at that point he got better, behavioral therapy worked for him. He went into an eating disorder unit for a number of months, and then of course had lots of therapy thereafter. And he started eating again, and he was joyful. He started smiling again, and we thought we had dodged the bullet. But shortly thereafter, he started drinking to excess. And then through high school and college, he really took it to excess and graduated from college. And we thought, oh, he's doing well. He graduated from college. He did well in college. He was like A minus average in biology and computer science, and even with a special honor in Latin. So he was had a lot of breadth in terms of his interests. And tons of friends. And that's where I'll sort of end because in my description, because he had tons and tons of friends, and everybody would say he was my best friend. And they would say, I don't know if I was his best friend, but he was my best friend. And so he always had tons of friends around him. But on the flip side, he was lonely too. He needed those friends around him, and that kind of insecurity and anxiety that was connected with his anorexia lingered, and he was concerned about it. He didn't think, he was embarrassed about it because he thought it was a quote, girl's disease, and of course it's not. It affects men, manifests in somewhat different ways. But that's sort of what led us to his death in May of 2015, and then since then I've been working on this book, trying to work it through and deal with the grief. And we can talk about more along those lines if you want. So.
Yeah, first of all, I'm sorry for your loss and thank you so much for sharing. I can't imagine what that was like, but to take your own journey and loss and turn it into advocacy, talking about it, helping to reduce the stigma really makes such an impact. You are amazing.
That's what I wanted to do. I wanted to speak for those people who might not be able to speak for themselves, and write about really everything that we went through, so that people who were in the situation that my family was in would know that I saw them, and I really understood them. And every day when I sat down to write the book, I thought of all those people who were like me, and I wanted my book to be to reduce that stigma. And I'm sure we'll talk more about stigma because it was really stark and raging, both about mental health issues, but also about drug addiction. So.
Yeah, the stigma is terrible. So many people feel like they're going through it alone, people who are struggling, and then their family members and loved ones feel like they're going through it alone too. I know for me, I struggled with severe depression and was hospitalized in a psych ward after 3 suicide attempts. And the one thing that my parents always say is they didn't know who to talk to about it when they were
Yeah.
going through it as well, because no one wants to talk about mental health and then to admit that they had a daughter who was struggling, and what if people judged them and they didn't know what to do, and it felt very isolating
Hmm.
because you don't know what to do when you're going through it, and looking for that community and that support, but being afraid to talk about it
Yeah.
makes you feel honestly helpless and hopeless is kind
Yeah.
of the way they described it.
Yeah. Oh, I know. I feel for your parents, but they must be so proud of you at this point.
Sometimes.
That you went through it and you came out the other side, and you're now helping other people. Just like I hope that I'm doing as well, because by speaking it out loud is really, really critical. Because you're right. I know exactly what your parents went through, and feeling like you didn't want to talk about it, and then now I feel like, okay, I've just opened up my life to everybody at this point, but it's very freeing. uh, my husband sort of had a very different reaction. He was really, he has a chapter in the book, and it's very raw and very emotional, and that's really the way he responded to it. And he couldn't understand why I wanted to keep reliving it. And I said, I have to relive it because I have to make sense of it. And I also have to make sure that other people are able to know that we are not alone, that we are not embarrassed, right? That we will stand up to the stigma that others foist upon us. So I have a lot of respect for what you're doing. So keep it up, and I'll keep it up too.
We have to, because talking about it is the only way to make an
Yes.
impact. And listening to what you said about your son with anorexia, feeling like it's something that women go through.
Right.
So then making you feel isolated in it. And why am I like this when I'm not the common demographic of it? And when
Exactly.
we don't talk about it, people have this misunderstanding and they don't, first of all, always recognize or know what to do because admitting to someone else something that feels so secretive.
Right. Right. Exactly. It's very, very hard to speak that truth. But when you speak the truth, it's very liberating, right? You must feel that. It's very liberating to feel like, I'm just going to do this. And good for you that you're doing it at such a young age. I like the fact that you're sort of speaking to your generation and, saying, hey, if it happened to me, and I say this all the time, and I put it in the book multiple times, if it happened to my family, who was just I call it a good family, right? In quotes, because that has certain kind of connotations, but it's a normal family, right? It's a normal family. If it happens to someone that looks like, us or looks like your family, right? That means it can happen to anybody, any family. And families don't always like to hear that, right? Because they want to know that, oh, something must be wrong, right? I've had people respond to op-eds that I did, and I say, well, it must be the family problem. The family did this, they didn't beat their kid enough, or they didn't force this out of him. And, anybody who deals with this, whether it's anorexia, whether it's mental health issues, whether or not it's substance use, that it doesn't just happen because of choice, right? And that's really a kind of important point that I try to get across in my book, because I look at it like a sociologist looks at it. And, people think that people choose to be this way. I mean, even with mental health issues, that people choose to be, anxious, or they choose to be depressed, or they choose to take substances. And, it's not really that way at all. I mean, Alex said on multiple occasions, do you think that I want to be like this? Right. And of course, we didn't. We didn't think that, but there was so much sort of the systemic or larger structural issues that affect it. So, what I try to do in my book is I try to say it's not really choice, a brain disease. Those are really very much personalistic explanations. I look at it like a sociologist and I say it's so much more complex and so much more nuanced. And so if you think about it, it's really everything happens within a context, right? And that's what sociologists like to talk about, right? Context. And it's not that we don't make choices. Of course we make choices, but we make choices within particular contexts. So those are structured choices, right? A sociologist would say. And so what's the implication of this, right? It's not just personalistic kind of explanations, but rather you got to take into account all those aspects, like psychological kind of issues or socioeconomic issues, like, do you have uh, um, abuse? Do you have any other, do you have incarceration or racism, right? Are there things that you, in the context in which you live, that could be, that could lead you to self-medication, right? And in drugs, sort of is less true, right, in mental health kind of issues, but with respect to drugs, people often take drugs because they're self-medicating something, right? Anxiety, depression, they want to get out of their head, right? They don't want to feel this way, and so they self-medicate. And so that's very different from just saying, oh, I'm going to choose to take drugs because it makes me feel good, right? Many people take drugs because they want to get out of their head. They want to self-medicate. They don't want to feel depressed. And Alex wrote about it. I have a lot of I've included a lot of his writing in my book because I want people to hear it in his own words. And he says that. He says, I felt better when I drank. I feel better when I took drugs. You don't want your son to feel that way, but the fact that he understood that, right? He was smart. He understood that, and he didn't want that, obviously.
Looking at the cause is really important, and recognizing that, like you said, it's not a choice.
Yeah.
If we stop looking at this as someone is choosing to utilize substances to escape and feel better because they don't want to try anything else, and that's they're choosing to go down this route, we would change the way we approach it, the way we utilize treatment, the way
Yes.
we help someone. Because
Yes.
a lot of times we go straight to incarcerate people away without ever giving them a chance to access resources and help that could
Mhm.
make a difference.
Mm-hmm. Oh, you just hit the nail on the head, right? That is so important, and it's the number one, the important in thinking in terms of solutions, right? We know that the war on drugs is an utter failure, right? But that is the kind of go-to mechanism that especially politicians want. They just want to take care of it, and they want to deal with it in a criminal justice way. And we have to think about it not in a criminal justice way, but in a public health way. And if we think about it in a public health way, we're going to help those people who are going through, anxiety and depression. And that's so critical because how does it help to throw people in jail? These are people like like Alex, and like his friends, and like you and your friends. I'm sure you know people who have gone through this as well. And it's just like, why throw them into jail? Because that doesn't solve the problem. I mean, really believe that it's a choice. It's a kind of easy explanation, right? Because they say, okay, I don't want to deal with this. I think people who are addicted, should be out of sight, out of mind. It's an easy solution, right? We take those people and we put them in jail. And then we shun them and we shun their families because their families are going through these kind of, obviously people think, oh, the family must be doing something wrong. If they were doing it right, their kid wouldn't be having their child, their kid, their young adult wouldn't be having these issues. And it's just not that way at all, right? These are precursors to that people want to self-medicate for.
Absolutely. It's so easy for people to sit there and try to toss blame and not want to
Yeah,
look at actual causes and what solutions are out there. I have
right.
someone in my life who struggles a lot with substance use and has been in jail a few times, now lives in a transitional home and trying to figure out kind of what to do and how to get the medication. He lives with bipolar 1 disorder, and first of all, affording medication and a psychiatrist is really expensive.
Yeah.
Not a lot of resources when you are a young kid who ends up in jail and hasn't had a chance to even have any money or have a career. If you don't come from money to be able to get out and afford health insurance,
Right.
to be able to get support. A lot of times you can't really get a job after being incarcerated. It's a lot more
Yeah.
difficult. So getting set up, all these tools are working against someone who he probably should have been diagnosed earlier and gotten support and resources, but no one really talks about
Yeah.
the symptoms. And especially bipolar 1 disorder in men, it can just seem as, oh, they are reckless. And
Yeah.
that's just something that teenage boys are, and not really talking about mental health, looking at symptoms, warning signs, getting access to support he needed. It got to a point where now there's no resources on the other side to really help him. So
Mhm.
then he's kind of stuck in this system, and people are like, well, he's choosing to be. But
Yeah.
he's not. The system is not working for him, and it's not working for millions of people.
Right, exactly. And you can see the kind of sociology of it that you just shifted into,
Yeah.
right? When you talked about the fact that if you go to jail and you get arrested and you get incarcerated, right? That becomes a check that it's hard to get beyond because and most employers don't want to hire people who check that box, right? And so that's a kind of larger context. That's what sociologists call systemic kind of explanations that then just like you're describing it from your friend, right? This becomes a kind of self-fulfilling prophecy, and it becomes really very negative outcomes on the lives of thousands and millions of young people. And I think it affects males in particular who end up getting incarcerated larger numbers, but it affects women too. Young women who find themselves falling in that exact thing. The other piece of it is that if people do get to treatment programs, lots and lots of people never get into treatment programs. So that there's a lot of people who have issues of substance use who never make it into treatment programs. Now, some of those people just age out. Those are the lucky ones if they age out by the age of 30, or, like 70% of people who end up even with severe drug problems, they age out by the time they're 37, right? So Alex was just 25, right? But the problem is that the treatment programs, even if you do get into treatment programs, the treatment programs are not effective because for the most part, they're entirely 12-step programs. And 12-step works for some people. I had some friends of Alex's who, swear by 12-step programs. So it does work for some. But something like a third of treatment programs don't have any medicines, and medications have been shown to be very effective in addressing substance use. And if the treatment programs don't have them, then they're short-circuiting the possibilities that those people who actually get into the programs can succeed. So, methadone, MAT, it's called MAT, M-E-T, medication-assisted treatment, medication for opioid use disorder, which goes by MOOD, M-O-U-D. And so, but most places don't have it. So the people don't get access to it.
Yes, so I'm currently doing my master's in clinical psychology, and this is something we learned in our substance use course, because a lot of people came into that class and she asked, well, how do you treat someone who is struggling with substance use?
Yeah.
And everyone's like, we'll get them into AA. It's just like, that is an option. Absolutely. But not everyone responds well to a 12-step. So what else? Everyone was like, rehab. It's like, what else? What tools are you utilizing in rehab? What are you utilizing in a treatment recovery program? And we realized that most of us didn't know what was out there.
Right.
We didn't know what worked because it's the conversation that is commonly had is the 12-step programs, which work for so many people, but does not work for everyone. And it's about finding treatment options and talking about treatment options that give every single person a fighting chance. And harm reduction strategies are a huge one. And medications that help minimize cravings and the symptoms of withdrawals so people can start to detox. It's huge.
I think that's right. And, the fact that about harm reduction is really important because most of the people, I'd say 90% or more of people that I interviewed in my book had no idea what harm reduction is. So it's I didn't know about what it was when when Alex was going through it. And I didn't learn about it until I started doing research for the book. And the more I read about it, and so I have a chapter in my book where I talk a lot about it because I was just learning about this and it seemed like it was such a good option. And in my epilogue, I do a kind of counterfactual that says, what if we had lived through a compassionate harm reduction world, and might Alex have lived? And I asked that question because if you think about the way that harm reduction works, you treat people where they are, right? It is such a different way and such a compassionate way of addressing these issues because, it's like what works, right? What works for that person, and any small improvement is good, right? You're moving in the right direction. Obviously, you want people to not take drugs, but there are a lot of people that take drugs that don't get addicted. It's something like only 10% of those who take drugs get addicted. And so, so I ended up a real harm reduction enthusiast by the time that I finished. So you should tell your class that they should read my book. So the inside dope no, don't use the term dope. Give them the inside information about, how to think about it and how to explain and think and write about it in a different way. That's really what I tried to do in my book.
I love that. It's really about changing the perception that
Yeah.
people have
Yeah.
because there's so many misconceptions, and it's written in anything to do with mental health or behavioral health, I'd like to say, was very much written in as if it's illegal. So even the term committed suicide, we don't use that language anymore because committed meant a crime. It's
Right.
a lot of things connected to behavioral health. We have an eyesight of a crime.
Right.
And if we can start reframing it to a human being, and what can we do to support a human being where they are right now in this moment, the most essential first step we can take.
Yeah.
With
language, you're talking about language, right? Language becomes critical.
It does. It changes the way people respond to how you're talking to them too.
Mm-hmm.
It makes people feel safe to open up, to talk about it, and to maybe consider looking for support and resources, or maybe think about finding support that works for them when they're ready. But if you are automatically talking about it in a way that's stigmatizing, in a way that's making people feel isolated and not good enough, or like something's wrong with them, it's not helping. It prevents so many people from ever wanting to admit to themselves that I need support and to then access support, especially when people who are as future therapists, if we don't know the right language, if we don't know about harm reduction techniques and how we can help someone, if we think that there's a one size solution to all of it, we could really impact someone ever getting the treatment that they need if they finally have the ability to access treatment.
Yeah. Yeah, absolutely. That sounds exactly the way that I would think about it. So did you learn about harm reduction through your class or just in other work that you've done, or what?
So both. The first harm reduction I learned about was Narcan. There was a firefighter who was just offering free trainings and giving out Narcan. And I did his training, I think 3 different times. He just happened to be in the area I was in, so I went. And that was the first time I learned that there was something that we could do if someone was to overdose in front of you. And when I would tell that to my friends, I was like, here, have a can of Narcan. They were like, well, why would I be somewhere where someone would overdose? And I was like, maybe you aren't. Maybe someone on the street has overdosed and you are there and you can help them.
Mm-hmm.
You don't know. You don't know until you're in that position. Why not have something that helps? Hopefully you never use it, but hopefully if you ever have the opportunity to use it, you have it with you. That was one of the very first things. Then in class, I learned about the needle exchange program because I go to school in California and that's something that's happening there. And I was very skeptical at first. I'm like, how is that helpful? And I remember when my teacher sat down with me and she was like, okay, if someone is using a dirty needle, they're addicted, they're going to continue to utilize. If they're using a dirty needle, that's harmful, right? That can cause infections. That can cause someone to die before we can give them help. So if we get them into the door just to exchange the needle and they know where our resource is, what support we have, if there's pamphlets out there, then maybe they look at and grab. Maybe one day they will be ready to access support. But if we don't give them a chance and we allow them, we know that this can kill someone. We know that the infection itself can just kill someone. Why wouldn't we try to do something that helps and meet them where they are? And that really opened my mind and really made me reframe the way I was considering mental health just as a whole and behavioral health and substance use. And then recently I met with Representative Hunchowski in the state of Florida, and she was telling me about fentanyl test strips. And she was like, I was really surprised that they got passed in our state because that's not usually harm reduction isn't done a lot here. But she was like, a lot of people come to her and say, well, why would we need that? Because we shouldn't be doing drugs. And she was like, okay, maybe you don't need it, but what if you're out at a bar and someone drugs your drink, having a fentanyl test strip? Then someone who has a loved one who is struggling with substance use and being able to offer them that little support resource, that tiny tool that may not seem important to you, but until you have a loved one who all you want to do is keep alive, that tool means everything. And that really, again, helps with my mindset a lot because until we have these conversations, we don't know. And that stigma that we might not even realize is in our heads until someone talks to us. And that's why I'm such a huge advocate for talking and for learning and listening, because I don't even realize that I'm being impacted by the stigma or that I'm being biased until I've it comes to my attention, right? Until I hear someone say it, I'm like, can you explain that to me so I can learn? And I'm like, wow, I never thought about it in that way. Thank you for teaching me.
Mhm. Oh, that's really a couple of responses. One of which is that I try to carry around I try to carry it around in my pocket when I live in Washington D.C. and I just carry it around in my pocket, And we had somebody just at the end of our block, two young people die of overdose just at the end of our block. And you think, oh, if somebody had been there, maybe the EMS didn't get there fast enough. So it's very useful to do that. That sort of you probably have heard about this, that needle exchange really comes out of the AIDS epidemic. And in fact, the whole harm reduction approach is something that in part emerged out of the AIDS related crisis, because those first harm reductionists who talked about needle exchange were dealing with AIDS, right? And it became very important because the people, if you exchanged needles, then you were less likely to take it home and give it to your spouse, who then gave it to a child, right? So there were, women and well, there have always been women who have done drugs as well, but with respect to AIDS, and so you've got to make sure that you address those. And just as a small point about fentanyl test strips, a friend of mine who's someone who's written about this, Christina Dent, who is an evangelical Christian who has written about this. She lives in Mississippi. And she told me that Mississippi just recently initiated fentanyl test strips in Mississippi. So, you think, yay in Florida, yay in Mississippi, that people are now seeing this as an issue to address and not just viewing it as enabling. Right? Because I'm really hoping that what we're doing is moving out of this idea that any kind of addressing this via exchanging needles or test strips or, whatever is a way of enabling. Because, I think that the whole crisis, the whole overdose crisis, is something that is reaching out into so many different families. It's red, it's blue, right? It's people who are poverty. It's all the way up to people who are, middle class and upper class. Everybody is subject to this, and if we see it that way, then we don't sort of think in terms of othering, right? Oh, it's these other people who are doing this, not my family. Well, it's happening to your family as well. You may not know about it, right? But it's happening to everybody, my family, your family, other families, right? And so we have to think about it that way. And I think as people begin to think about it, they're more open to issues such as fentanyl test stripping. And it's just going to keep getting worse, right? The newest one is xylazine, which is like originally used as a veterinary medicine. So it's just going to go from one to the next because there's always going to be a demand for drugs. It's just, there always has been and there always will be. And we're not going to deal with it by just thinking about it as I think many politicians do, which is that we just have to deal with supply, right? If we dealt with supply, then we'd solve the problem. Well, no, you won't solve the problem because first of all, you're never going to be able to address issues of, synthetics like fentanyl and xylazine and whatever the newest one that's going to come down the pike. These are synthetic, I was going to say medicine, not medicines, drugs, right? They're drugs that are, the precursor chemicals come in from China and they come into Mexico and the cartels then send them here. But it's not that there's this huge immigration problem where these other people are bringing them across the border. It's American citizens who bring these drugs across the border at the regular points of entry, right? It's not that they're coming, through the Rio Grande or something like that. They're coming through the regular ports of entry and they're being carried by American citizens in large measure. So I think we've got to think about it. We have to have the political will of politicians, right, who say that's really not the way to think about it. The way to think about it is to really think about the demand side, right? Not just the supply side. We got to think about, why is it that people want drugs, right? Why do they take drugs? And so much has to do with these sort of larger systemic factors, trauma, abuse, racism, right? I mean, you name it, these are things that help to produce this feeling, this need for people who want to self-medicate.
Yes, someone recently told me that a common cause of opioid use disorder is people being prescribed like Percocet and oxycodone as a teenager after a sports injury.
Yeah.
And it starts that early. And yet, a lot of times, people want to sit there and say, it's a choice. It was something prescribed to them by a medical professional who thought that was a good treatment option for them. Whether or not it was at that moment in time, I don't know, because I'm not a doctor. But someone who they trusted thought that was a great treatment option for them, gave it to them. They became addicted and needed it. That is not someone choosing. And people just want to go straight to all the time, everything is a choice and people are choosing to do this. And why are we going to help someone who made this choice? No one made that choice.
Right.
And why don't you want to help a human being?
Exactly.
We have to stop with,
Yeah. I mean, you have to think about it as, what's the humane thing to do? I think there are, examples of what you're talking about. I know parents whose children were given oxycodone, for example. But the other piece of this is, and that's, I think certainly some people get into that, but then you have to say, well, why is it that that young person continued that, right? Because, we use fentanyl in lots and lots of medical procedures, right? People who are at end of life use oxycodone, and yet they don't become addicted, right? And I'm sure people who have been in the hospital and had fentanyl while they were in the hospital, and it really works to cut back on your pain. But once you get out of the hospital, right, you don't keep it up. So it's that second step, I think, that it's really important to talk about. Why is it that somebody would keep taking these and keep wanting this? And that's where I think the self-medication comes in, right? It's important. There's a history about this in terms of the Vietnam War, when I don't remember the percentages, but the percentage of Americans who were in Vietnam who were addicted to heroin was extremely high. And people were very, very concerned, right? President Nixon was saying at the time, oh my God, we're going to have a huge heroin problem when they come back. But you know what happened? I mean, researcher after researcher shows that they came back, they got into their regular life, and they weren't addicted. They just got off of it because they didn't need it anymore. There were certainly some people who kept up with it, but that tells you something, right? So that it's less the drug and more the kind of individual need for it, or the need to self-medicate. You might say, okay, well, the people who came back who had trauma associated with their service in Vietnam, right? Those people might be more likely to have sort of kept using because but what's the direction of causality, right? The direction of causality is that it's the trauma, right? And it's not so much the drug. It's bad that all those people were addicted to, or were using heroin back when they were in Vietnam, but then they just stopped when they got back because they had a life, right? They came back to their family, they got jobs, and they didn't need that. They didn't need to self-medicate in the same way.
Yeah, you're 100% right. Looking at causality is so important. It's more than just the drug. Thank you for sharing that, because it's so easy to, again, look at it from a single point of view, and learning that there's so much more that's happening behind the scenes that we're not talking about. For people who are listening who maybe they're hearing us, they're understanding what you're saying, but they don't know what we can do, what is some of your recommendations of things you'd like to see change?
Oh gosh. First of all, perceptions of how we view it, right? We talked about it earlier. Let's not fall into the idea that criminal justice system is the way to address it, right? So I think that's really important. So it's changing our perceptions as something that is looked at by the criminal justice system versus what I think we should look at it is as a public health measure, right? So that I think is a really important way to think about it. The second way is the second sort of almost as important is what the treatment programs and making sure that we have medications in our treatment programs so that they can give people a fighting chance. I mean, Alex was in 12 rehabs, and every single one of them was a 12-step program. Some of them were better than others, right? But he never got the help that he really needed to get beyond it. And he never got any medications, right? No methadone, right? No MAT, medication assisted training, or MOUD. All right, he got none of those. And so we need to move in that direction. We need to have programs that are actually evaluated for their success. And not one of the programs Alex went to ever did any kind of effectiveness evaluations. So we certainly need to move in that direction. We need to be aware of other kinds of strategies that are being put forward other than the kind of traditional treatment program kind of approach. But also, a third really important thing is insurance, right? We need to ensure that people are able to be in programs, more effective programs, right? For a longer period of time. Alex was never in for more than 30 days. 1 month, they said, okay, 1 month, you're in, you're out. Yet you look at how, what the programs themselves were saying about how he was doing. One of the things that I did, in addition to interviewing anybody who would be willing to talk with me, lots and lots of Alex's friends, but I also got access as Alex's medical air. I got access to the institutionalized records for every place in which he resided. So I had records of things that doctors and psychiatrists and social workers were saying about him. And so many of them, they said they didn't think he was going to be able to survive in the program. They thought by the end of the program, they thought he had a very high possibility of relapse. And yet they, ushered him out the door because insurance said that that's all that they were going to pay. And so 2 days later, he would relapse and end up someplace else. So it's just a broken healthcare system because we don't think here in the U.S. that we think. Well, I guess the way I would summarize it is healthcare is a right, should be a right, and not a privilege. And we think about it too much as a something that you got to pay for, right? It's not made available to those people who can't pay for it. So we need to rethink how insurance is. We need a universal health care, universal insurance for everybody. You just look at people who visit I have friends who live in Canada, and they just don't have to worry about insurance. And my sister just got back from Scandinavia, and she said, it is just phenomenal the way you hear people talk about it. They don't worry about getting their health insurance covered, right? They don't have to worry that if they get sick, they have someplace they can go. And so thinking about that is really, we need to move in that direction for sure. So, I think stigma is a critical thing, and we need to sort of, how do you deal with stigma? That's a really hard thing. I think talking about it, right, like you do, like I'm doing, right, I think it's really important because people think, wow, I hadn't thought about it that way. you said that a couple times, right? That when you learned about something, you hadn't thought about it in that way. And it changed your mind. And it changed your mind how you thought about how does one go about doing this? So,
Yeah.
I think that's really important. But also, there's so many more places, but I'll kind of end there just by saying we just need the political will, right? We need politicians to stand up and say, take stands and agree that we need to move toward a harm reduction approach. We need to have, even I found myself more and more radical in terms of, even after I finished the book, I felt like, oh, I really see myself moving in a much more radical direction. Like I truly believe that we should have overdose prevention sites. And if that had been available to Alex, he might not have died because there would have been a place he could have gone to that would enable him to use drugs. And it's okay because, maybe you'll use drugs that time, but coterminous with that overdose prevention site is a place that helps you get off of drugs entirely, right? And right, it's been illegal in the US until about 2 years ago when finally there were 2 in New York City. And now it's moving into Rhode Island, Providence, Rhode Island, and Minnesota, they're talking about it. So more states are starting to move in this direction in something that as recently as 5 years ago was considered impossible, right? What? You're gonna allow people to come into this site and use drugs? You know,
Yeah.
that's just much too radical. But what do we want to do? We want to save lives. We want to save people who are, otherwise going to be using drugs because they can age out of it, right?
Oh, these are all such important changes that we need to be talking about. I learned recently because I turned 26 that when going on to private insurance, a lot of them don't cover behavioral health. And I had heard people say that, but I was like, mine always does. I had to get on my own insurance and learn that most don't. And that was mind blowing to me because it's services people need. How would we not help people get the help that they need?
Yeah.
And then realizing how many people were against harm reduction, how much people had to fight, how many legislators had to fight to get something small, something that seems
Yeah.
so small that shouldn't be. Let's fight against it. To see how broken the system is absolutely disheartening. But seeing people like you talk about it and hopefully help get more people talking about it so we can make a change is just amazing. As we are wrapping up, can you tell people more about how they can find you and your book, Surviving Alex, Mother's Story of Love, Loss, and Addiction?
Sure. Thanks for talking about the book, and thanks for having me. I really enjoyed this. Any families whose loved ones have issues with mental health or substance use, there's a resources section in the back of the book. But even better than that, I've been keeping up to date a resources section on my webpage. So people can log into patroos.com, patroos.com, patroos.com. And look to the section on resources, and I keep track of all the readings that I recommend and places where people can go. There are wonderful resources that weren't available just 10 years ago when when my family was going through it with Alex. There's a great webpage called Moms for All Paths to Recovery that is just, every time I get on there, I learn something new. And so that just didn't exist. I would have loved to have had that available to me back 10 years ago. But there's also wonderful support, Mobilize Recovery, and so all of that I have in the resources section of my webpage. And so I really encourage people to take a look at it and, take advantage of the useful links that I include.
Thank you so much for listening to Normalize the Conversation. Don't forget to subscribe, rate, and review. This podcast is an initiative of Inspiring My Generation, focusing on normalizing the conversation, bringing education and awareness to the forefront, and amplifying global voices to spark change and hope. Inspiring My Generation is a 501c3 nonprofit organization on a mission towards suicide prevention through awareness, conversation, education, and support. Connect with us on Instagram at Inspiring My Generation and visit our website inspiringmygeneration.org to learn more about our work and how you can make a difference.